Today's KDA Video Minute is brought to you by Care Credit, the KDA's endorsed provider for patient financing, making care possible today.
I'm Executive Director Kevin Robertson, and this is the KDA Video Minute for Wednesday, April 10th. Well, last Friday, the Kansas legislature hit their first adjournment. So, you know from past years that the Kansas legislature takes a break after that first week in April. They come back May 1 this year, so they have this 3.5-week break. And when they come back, they'll be addressing really the main issues of the session to finish off the budget. There's some tax relief packages that have been in the mix and some other things. So that'll be going on here May 1. So for now, let me give you a quick update on where we are with some of the KDA issues that we've talked about this past year. Of course, dental therapy never had a hearing. It's basically been dead for quite some time, but it continues to be dead, so I want to make sure everyone's aware of that. House Bill 2307 was the bill that had to do with insurance, specifically non-covered services. We're trying to amend the definition of covered service to include de minimis coverage by an insurance carrier, which means basically this bill would restrict an insurance carrier from paying a very small amount on several different procedures and then saying, hey, we cover that, therefore we can dictate the fee that a dentist charges. That bill passed the House with about 91 votes. Right now we're trying to get it into a conference committee. We weren't able to get that done prior to the break last week. We're hopeful when they come back for the veto session in May, we'll be able to get that into a bill and get that passed. That's still hanging out there and something we're trying to get done. We'll be talking to members of the conference committee that's putting that together. We may need some of your help here later in the next week or two, and we'll let you know who can help us contact what legislators as we get closer to that May 1 veto session. Also, you know, we were interested in increasing CanCare Medicaid rates. We were able to get a $3 million increase in Medicaid rates. Right now, that is in the big budget bill that's still sitting out there. So the $3 million increase is in the budget bill, but the budget bill hasn't been passed. So that's not a done deal yet, but we're very hopeful. Right now, it is not a controversial item that it's in there, but there's still a lot of working parts with regard to getting that budget finalized. That'll happen when the legislature comes back in May. Also, association health plans. You know, the KDA has been trying to get an association health plan that is fully insured. That required some legislation. That legislation has passed. It's on its way to the governor. It was passed right on the Friday before the break, actually. However, the legislature wrapped in a bill that had to do, that the Farm Bureau requested, that was a very controversial issue with regard to an insurance coverage or non-insurance coverage outside the Affordable Care Act. That's controversial. The Democrats have been definitely opposed to it. We don't know what's going to happen with the governor. She may veto that piece of legislation, so we're watching out very closely on that. If it's vetoed, can we save the association health plan piece? So that's still out there, and we're working to make sure that that gets passed. Finally, corporate practice of medicine. You know, that's an issue that we teamed up with several of the provider groups, including the Kansas Medical Society, to fight corporate practice of medicine. There was a compromise reached with the Kansas Medical Society, Cerner, Blue Cross of Kansas City, the Chamber, and Americans for Prosperity reached an agreement with to move that bill forward. So the Kansas Dental Association is not in the bill, or dentistry is not in the bill, optometry is not in the bill. Only medicine and chiropractic is in the bill as it stands. That bill has passed the legislature and is on the way to the governor. We would expect that she would sign that. Finally, K-TRACS funding. Right now, again, it's still in the budget to fund K-TRACS. Right now, the proposal is to fund half of that from the state general fund, the other half coming from all the provider licensing boards. So it's about $600,000 in state general fund money, another $600,000 split between the licensing board. So that isn't quite wrapped up yet either, but we're keeping an eye on that too. So those are kind of the main legislative issues we've been working on and where they are. We may be needing to contact you later this as the session finalizes here in the next month or so. So please keep an eye on those things, and we'll keep you informed as to what the progress is on those issues. I want to wrap up today by reminding everyone about the KDA Summer Getaway. This year we'll be in Chicago at the AC Hotel by Marriott, June 6th through the 8th. That hotel is located on Rush Street, right in that main area of North Michigan Avenue, just a couple blocks off Michigan Avenue on Rush Street, where all the restaurants and entertainment district is. So it's a fantastic location. We got a rate at the hotel for less than $200, I believe, or $189 for that hotel per night. So fantastic rate, fantastic location. Love to have you. Please sign up for that. Registration's available online here. It's been available. If you're a first-time getaway attender, you, as well as your staff and guests, can get 10% off on that registration fee. So we encourage you to take a look at that. We'd love to have you and spend a couple days with you in the summer out in Chicago. With that, I'm going to wrap this edition of the KDA Video Minute.